time that your ears perked up a little when you heard low cost MPH, because that might be something that is of interest to you all subsequently. Um, so I think we're right on the hour now and we're ready to start, but perhaps I might also ask um, the three other tutors who didn't have quite as long a time in our first meeting and who are all on with me today, and with whom you're going to be breaking up into small groups to have as our next agenda item after I review the agenda, introducing themselves. Perhaps Valeria, then Miriam, and then Hugo. And Hugo, maybe you could, along with your self-introduction, tell everyone about the two questions that we're going to be addressing today. So I will also reintroduce myself at the end of that, because the remainder of our agenda is going to be having some in-depth conversations about what are important examples of collaboration and the need for collaboration to be successful in leadership, and what are good examples and maybe some not so good examples of different techniques that you've observed in leadership and read about over the last week. So this is going to be quite customarily our habit that we will have some collective pieces in subsequent weeks. We will have some guest lectures from some really extraordinary people who have been leaders in public health globally. And then we will always, it is our expectation, break into small groups. You will be doing a lot of peer activities in this course because your peers in this course are extraordinary public health leaders themselves, yourselves, as we talked about last time. So might we then, Valeria and Miriam and then Hugo, introduce yourselves, and then we will leap into our substance, which will be me talking about one experience that I think illustrates a lot of the points that we're talking about this week in terms of public health leadership, and then breaking into small groups to address the issues that Hugo is going to enumerate for you. And you'll be, if all goes well, you will be randomly assigned to one of three groups, either just me, Valeria and Dick, or Miriam and Hugo. And we will change these groups over time, though we will have one 40-minute breakout session with these three groups today and then reconvene for 15 minutes. Okay, Valeria, you want to do a bit more of an introduction of yourself?
Thank you, Erica. Welcome, everyone. I'm Valeria Reynolds. I'm a physician from Bolivia. I'm currently living in Spain, working through my preventive medicine and public health residency program. And I'm also working with NextGenU for quite 6 months already. And I'm working with Dr. Herler on leadership with the People's Unity team. Welcome.
Thanks, Valeria. Miriam?
Hi, my name is Miriam. I have 6 children. I think you just heard one of them. I'm the Chief Executive Officer at NextGenU, and my specialty area is in globally scaled public health solutions. Thank you.
And Hugo?
Sure. Welcome. I am Hugo Rojas. I am a physician from Bolivia as well. I am working in the instructional design team of NextGenU.org. I would like to highlight that in NextGenU, a very good proportion of the team members are from Latin America, and we have members from the Caribbean as well. That is something that is very enjoyable. And well, this class we will be discussing some public health milestones and how collaboration was essential to achieve them. And we will be also looking at some public health figures and evaluate their leadership strategies and maybe some not very good strategies as well. So happy to be with all of you today.
Hugo, thank you. And maybe you could paste those 2 questions into the chat space so that people can start thinking about them while I tell the first case study that I want us to present on that. Just to say again, so I'm going to tell you this case study, and then we're going to break up into 3 groups, which we'll do for about 40 minutes. And then when we have 15 minutes left at the end, we'll come back together as a cohort. And during that time, you'll have early on, though not necessarily the first thing, you'll have picked a reporter to come back and tell us for 3 minutes for each of the 3 groups, some highlights from your conversations about these 3 questions. And then we'll have a few minutes at the end to talk together. A critical part of this experience today is that this is our first time to really be together in the classroom without WHO in a formal opening ceremony. This is our chance to begin to get to do the kinds of collaboration that you've been reading about this week in terms of improving our leadership skills in the frame of improving our leadership skills. So Hugo, if you want to, it looks like you've pasted that in, thanks. And great. And yes, important point that Hugo appended to the end there, that this week's individual activities also build on these questions. So this is a chance for you really to start thinking about what does leadership mean to you? And I will start with a sub anecdote that happened just a few minutes ago, talking with one of my colleagues from Yale, where I did my preventive medicine residency. And we were talking about a course that we're going to be developing together. And there was a competency in the course about leadership. And this is a, pretty senior professor at Yale. And he said, public health leadership, I don't really know that I've ever taught that or been encouraged to study that. And it was just such a, and he was so excited to hear that we were doing this. So just for you to know, this is something that is not part of everyone's training. And we're really thrilled that you think it worthwhile enough to want to do it. And we want to make sure that we hear from you during the sessions, between sessions, as well, about how we can make this the most engaging and useful experience for you. So one other piece of housekeeping around that, which is I'd encourage you to have your videos on when you're feeling up to it and your bandwidth is feeling up to it. There are going to be a lot of peer activities, and this is your first chance to indulge in them. So thank you, Alicia, for turning yours on. That's great. All right, so my case study. I want to tell you about how I got DuPont to withdraw their bid to manage the Savannah River nuclear site, and which Hugo is showing you here. So this all started around in the early 1950s. And as you can see, the US President Truman, sent a letter to DuPont saying, we're doing this new atomic project. You're a trusted creator of explosives for a century. They started in black powder and now in chemicals. And we want you to do this for a nuclear facility as well, which was planned for a rural area in South Carolina. China. So that was step number one. Step number two, in 1987, DuPont said, we're not going to do this anymore. And they, the government and Westinghouse, which had also managed it some in the past, took over the management of it. So all of that was preamble. And this, like I said, in a couple of years later, it got regulated by the US Environmental Protection Agency, which is really where it belonged. But then it went back into private hands with Westinghouse. So that's the history of it. And that's what it looks like as it's being assembled and disassembled. And what they processed in there is tritium. But what they also provided from there is a story, is propaganda, right? And this is a, everybody's jolly hats in the air picture of the company, where what they're really doing is taking a very hazardous substance and allowing that hazardous substance to continue entering the waste stream. So we have any other slides there? I think, is that the last, Hugo? Yeah, okay, so we can turn off the slides now. So all of that brought me to when I was living in Georgia on the other side of the state. I had co-founded the Georgia chapter of Physicians for Social Responsibility. I was a professor there, and we and some of our colleagues had led protests at Savannah River site. There was discussion about moving the nuclear waste from there to Yucca Mountain all the way across the continent. And I went and spoke to the legislature, 6 months pregnant. It was one of a few times that I used my son as a public health prop, and talked about how this was not a safe thing to do, to move what was then being called mobile Chernobyl across the country. So had tried doing protests, had tried going and talking to our legislature. Well, as it turned out, I got asked to be a founding member, and was there for the whole decade of its existence, of the DuPont Health Advisory Board. This happened because I'd been an active volunteer in the American Medical Women's Association, and their head of communications, who was a doc on the Today Show, which was a big national program, still is in the United States, noticed me and said, we're starting this health advisory board for DuPont because they've been slapped with the biggest environmental protection agency lawsuit ever in history, 150 million US dollars. Will you come and be on this board? So I felt very ambivalent about it. I'd never worked with industry before. My venues had typically been organizations like Physicians for Social Responsibility, or working with government, or even doing protests. But I'd not worked in the corporate sector before. So I was eager to do it because I thought it would be a useful experience, but I wanted to make sure that I was out as being someone who would operate only on data and who would not be a yes person and a corporate shill. So when they sent the invitation to come, and if we needed any special food accommodations, I was at that point an aspiring vegan. And so I said I wanted vegan choices. I figured that could trigger some conversations. And indeed it did. So I'm going to conclude with two conversations that happened with the president of DuPont at these dinners. So we had, as the opening event for the board meeting, we would have a couple hours of work, and then we'd get to meet with the president of DuPont, president of an 80,000 person, I think in 80 countries then, organization, interested in hearing what we had to say. So we're all sitting there, and there's a little informal cocktail hour first, and we're sitting at dinner. And the president does some sort of generic opening remarks for a paragraph or two. And then he says, well, we're so happy to be hosting you. And Dr. Frank, we made sure that we had our newest product called Eighth Continent, which is a soy beverage here for you. And and he sort of turned to me, and everybody sort of turns to me. And this is the first time anybody besides the president has spoken. I said, yes, thank you. And he said, well, what'd you think of it? I said, well, it was delicious. And he said, well, will you buy it? And so there was this really, like, now everybody's really looking hard at me. And I said, well, it was very tasty, but it's made from genetically modified soy. And if I have a choice between GMO soy and organic soy, I'm going to buy organic soy. And you could like feel the tension in the room, right? And he, to his great credit as a leader, said, this is going to be a great group. And everybody just sort of had this huge relaxed, oh gosh, okay, this is all right. This is safe, right? So fast forward 5 years with meeting like this a couple times a year, building lots of trust in each other. And every dinner, he would give us this report of what was important that DuPont was doing then. And at this dinner, he said, as one of the things he mentioned, that they had decided that they were going to put in a bid to manage the Savannah River site again. Now, when he tells this story, he says, and then Dr. Frank almost fell off her chair. When I tell this story, I say, well, it made me pay attention. What ended up happening was I paid for my colleagues who had been doing these protests with me to fly up to Delaware, because they wouldn't take DuPont money, of course. And the president and the senior vice president for the environment, who had been the deputy director of the Environmental Protection Agency under President Bush, all got together. We talked about why it was a terrible idea for this plant to continue and a terrible idea for DuPont to support this. And they decided to withdraw their bid. So that was a huge victory. It was one of the most important things I've ever done in public health. And it was because I had built trust with these very different collaborators who then, through the law of reciprocity, I trust Erica and Erica trusts them, therefore I can trust this person, that's what made that possible. So that's my anecdote, my case study about leadership and collaboration. And I think we are now ready to go and dive in for the next 40-ish minutes. Maybe Hugo, you can reconvene us at, let's say, 48. No, let's do 45, so we have some chance for things collectively. And I hope that you will all keep up in your chat rooms, or maybe just note it down, but your tutors are here to help with that. These two issues that we're going to be talking about collaboration and public health achievements. And this is going to be a chance for you to talk about some of your experiences around that, just like I did, though perhaps at a little less length. Sorry if that was excessive. And about leadership and management strategies. Okay, any questions? Okay, I will see you all at 4:45, except for a third of you who I will see in a moment in our small group. I'll see you at 4:45 or your local equivalent thereof. Don't forget to appoint a reporter and look forward to hearing everyone's insights. Great. All right, Hugo, you're going to subdivide us, yeah?
Yes, just give me 1 second.
Sure, of course. Okay,
Okay.
I'm being invited to go elsewhere. I'm going to breakout room 3. See a third of you there. Hi, everyone. Looks like we're good, like we're all back. That's nice. Another one of the many advantages of working by video is we can go to our breakout rooms and 20 seconds later without getting up and moving our coffee and our laptop and our books and our bags. Here we are all again. Okay, so we had a very exciting set of case studies that we heard about from our group, and we have 9 whole minutes. So we're going to do a lightning round, 2 minutes each, please. We'll start with my group, and then we'll do Miriam and Hugo's group, and then we'll do Dick and Valeria's group, and then we'll have a moment of everyone talking if we have that moment, and then we will be done for this week with more information to be followed up by email. So Veda, you ready to present? You're muted.
I'm muted, right?
Now you're good.
Hi, good afternoon, everyone from beautiful warm sunshines of Trinidad and Tobago. Our breakout room included 9 participants from Trinidad and 1 from Guyana. We had a variety of expertise in mental health, in terms of project development, communication, disaster preparedness, environmental health. We had primary healthcare physicians all explaining to us their different roles in terms of public health leadership and relating some of their experiences with regards to collaboration. Coming out of it, we realized that a lot of them had expertise in terms of speaking about the technical and operational level in the execution of their projects in terms of both a community, regional, and national, as well as international levels. And all parties agreed that integration and collaboration is an integral part of public health programs. Some of the skills that are necessary in terms of being a good public health leader includes the ability to communicate, the ability to look at evidence-based decisions, the ability to have proper policy given, and in terms of executing all the different, at every different level in terms of actually executing their programs. But the basis of it is in terms of looking at the population's health. Some of them would have had experience with just projects that they had put pen to paper and coordinated, but the execution, they did not have the pleasure of doing that as yet. So hoping that coming out of this leadership program, they will acquire even more skills in terms of being able to carry them forward in further execution. We had one of our Guyanese counterparts that spoke about his experience in terms of HIV, and the breakout room, like we had a couple more seconds, so we were able to just conduct that within our group 3. We all had to put on our cameras, and some of us had to end up speaking. So it was all in all an interesting breakout room. Thank you.
Thank you. And I do just want to thank everyone who has their cameras on now, including, I have to ask Monique, do you have a Zoom background in back of you, or are you actually outside?
That's a Zoom background.
Oh, I hope that, so this, I wanted to mention that the reason why you sometimes see me moving is that this is in the action following principle that I ride an exercise bike, and while I'm talking to you and while I'm working on my computer often, and for many of our meetings there, you will not need to have necessarily more than just a video screen. You may not need to have a big screen open in front of you. We'll let you know if you do, and we'll get that to you ahead of time. So if you want to go to a place where you can go for a walk while we're having these conversations, that works for us, and we'll let you know if you need more bandwidth than that. because you do live in a beautiful ecosystem. And it's good to be able to promote health by being out in it. All right, Miriam and Hugo, who is your reporter?
Deborah, we share about what we discussed today, please.
Great.
You're muted.
Sorry about that. Deborah Thomas from Trinidad and Tobago. In these 2 minutes, we have to discuss 2 topics. We looked at the development of the smallpox vaccine from 1796. They were having a problem with smallpox. The vaccine was developed, but this is the Balmis expedition. There was no refrigeration, and you must have that. Electricity, transport was a problem. And so they got funding from the King Charles. It was a 3-year mission funded between 1803 and 1806. There was what we call an ethical dilemma, because they had to find ways without electricity and without to support live attenuated vaccines. And what they did is they used 21 orphans by injecting one at a time to have the live vaccines in their bodies, transported them so that they could have shared the vaccination and inoculated the population. So we looked at the fact that it was a dilemma, right? So they use human samples. After they got the human samples, because it was the actual cowpox, then they started transporting it through animals, but they literally carry the vaccines, right? So we looked at, it arrived and it came to the Americas. All of the Americas was eventually vaccinated, and we had smallpox under control, but at what price? Does the price for human lives and ethical breaches, right?
Thank you, Deborah. Is that okay? May we go on to our last group then?
Yes.
That sounds like that was a really rich discussion. Wow.
We had 2, but if we're out of time, that's okay.
Thank you. So the last group, Valeria and Dick, your group?
Yes, Callie is going to tell us what happened.
Yes, reporting from breakout room 2 with our lead discussionist Richard and Valeria, and we were from Trinidad, Bahamas. Suriname commented on 4 areas or your case. We felt like that there were the social aspect of leadership that was presented. You were able to show us having value of your opinion and being a leader in an environment. We also noted that there was a social aspect of leadership and relationship building to build trust over time. And that you also use your son and the wider community to think of what is the greater good and not only what you were presenting. And you talked about creating a safe environment and a safe place that the president had created to share opinions and articulate your concerns. Secondly, we talked about the particular public health achievement in the region, and Trinidad and Tobago reminded us of the Port of Spain declaration for NCD that CARICOM leaders came together to look at based on the data. It's now 10 years later. The leadership in Trinidad brought together the collaborative platform, civil society and private sector and academia, and we talked about the role of academia. We also, there's a really interesting question about leadership and collaboration. When is leadership and collaboration a good thing and when is it challenging? We know all the good reasons. The challenging example was one about tobacco and health, and they're being mutually exclusive because there are articles that prohibit working from the tobacco industry, mentioned how that's a challenge throughout the Caribbean in terms of really bringing the Framework Convention to completion because of the political leaders and their own agenda, or they're young, their lack of information or experience in this difficulty of collaboration. We talked about leadership and management strategies that public health has adopted. Again, a great example was leadership has to be charismatic. There may be a little bit of challenge because there are different people that you have to deal with, different personality, a lot of obstacles. Example from Port of Spain, dealing with regional plans might be different. Some people can afford it, some can't. There are obstacles. An example of high-handedness of leadership, higher level, top-down policies which helps us with setting out the standards and principles we need to talk about advocacy, the importance of being able to participate in protests, as you gave your example. Advocacy, it's important to stop and understand the stakeholders, to understand how do we need to educate them or influence them. And these were our general thoughts. Thank you.
Thank you. Sounds like these were three really rich and interesting introductions, and like folks got a chance to know what a remarkable cohort this is, which was a major point of this exercise. Hugo is going to see us out the door with just a brief summary of what's coming up with your assignments and readings for the next week. And we'll be following up also with an email for everyone too. Hugo, you wanna close with that?
Yeah, sure. First, thank you to everyone that has completed the pretest already. We have a very, very good participation. And we also have Monique that had their week 1 assignments ready today. Thank you for reporting. She found that it was not possible to create new discussions on the forums. So we will be working on that after the meeting to solve it. For each week, we will have a quiz and we will have some assignments. You will have time until the next Friday for the quiz and until the Friday after each week to submit the activities. Although in this case, we will extend the deadline and let you know in an announcement when will be the deadlines for these first portions. So next week we will have module 2. That is a short module. There is no much on readings. And we will have some assignments for that as well. We will follow up with very precise details on an email after the class.
Super. All right. Well, with that, I will encourage you off to indeed go and acquire Monique's background as you're able to. All right. Thank you, everyone. We'll see you in a week. Great next session.
Bye, everyone.
Thank you.
All right, great session. Thanks.
Thank you.
Thank you. Bye.
Thank you, everyone.
Bye.
Bye.